You absolutely do not have to have COVID to have cystitis. I could tell you that because I take care of women that have cystitis, and I lecture PT students on bacterial cystitis and non-bacterial cystitis. So let's have that conversation for anybody else that needs to know it. Bacterial cystitis is the infections you get when you have a bladder infection. Non-bacterial cystitis, like interstitial cystitis, happens when the mast cells in the bladder become exceptionally angry and become irritable, and then make you have urgency and pain. Cystitis isn't fun for anybody. Cystitis is irritation, inflammation. It makes the muscle of your bladder squeeze and feel terrible. And then you have referral pain to your lower abdomen. Also, because your bladder is a muscle, putting a heating pad on your bladder makes a huge difference. So in the evening, many of my patients that have cystitis put heating pads on their bladders. COVID is not a bacterial disorder. COVID is a virus. COVID is an inflammatory disorder. So I would say COVID-associated cystitis is a little bit like interstitial cystitis, trendy new pandemic friend. And the things that we do to treat interstitial cystitis is how in my brain we can cope with COVID-associated cystitis. But IC and COVID-associated cystitis have everything to do with mast cell disorder. So getting your histamines and mast cells under control is really important. Staying hydrated is very important. Dysautonomia and dysregulation of your nervous system is not helpful for anyone. And when you begin to have bladder pain, urgency, and frequency, learning how to do active relaxation, diaphragmatic breathing, learning how to control your nervous system is one of the greatest things you could do to help control your pelvic pain from your bladder. My interstitial cystitis patients will see an allergist. In Southwest Ohio, they see the Bernstein Allergy Group. Yes, bladder pain patients see an allergist. And usually the medications they get from the Bernstein group, which is one of the people in the Mast Cell Society's group, really turns the ship around for their bladder pain. So with COVID, we've learned we have to control our mast cells. We have to learn how to regulate our nervous system. We have to decrease inflammation. And the bladder is included in things we've got to calm down.